Hello, welcome. Today we're going to be talking about diabetes, diabetic emergencies, managing diabetes. I know the PowerPoint's a little hard to see. That's the best I got. We're going to do overview of diabetes, understanding what diabetes is. I guarantee someone here knows, has a family member, a friend that suffers with diabetes, and it's important to recognize the signs and symptoms of hypoglycemia, hyperglycemia, and diabetic emergencies. We're going to go over more of the types of diabetic emergencies, signs and symptoms, go over your local protocols, and treating within your protocols as an EMT. And then at the end, we'll do some case studies over diabetes. So, diabetes is defined as a chronic condition affecting glucose processing in the body, and it does have significant health implications if not treated and monitored properly. There's two types of diabetes: type 1 diabetes and type 2 diabetes. There's also a third that we're not really going to get into, gestational diabetes. There's not really anything we can do for that. So overview: type 1 is often diagnosed in children, also called insulin-dependent diabetes, juvenile diabetes, and usually requires insulin for the rest of their life. Type 2 is more caused from diet and exercise. A lot of patients do need medication, but some of them could be managed with proper diet and exercise. Both can lead to serious health emergencies. Monitoring is crucial, and education is crucial for treatment and recognition of those signs and symptoms. Insulin is a hormone that's produced in the pancreas that regulates blood glucose levels. It maintains stable glucose levels, helps the body absorb glucose from the bloodstream. So before we get too far into it, I want to just kind of familiarize you guys with glucometer, how to use it. Your standard regular glucometer, Lancets, test strips, the actual glucometer. So what you're going to do, take one of these alcohol preps, wipe off your patient's finger, whichever finger you choose, and then it may, depending on your service, what kind of things you carry. Ours, this comes out, you just twist that, and then when you're ready, press it tight against the patient's skin. You're going to deploy the needle. Take your test strip, and there's two sides. This side kind of looks like, reminds me of a computer chip, and then this side is where your blood's going to go. So you put that in your glucometer, wait for it to come on. Okay, and then it'll tell you that it's ready to accept that blood. And so you're just going to place that on your patient's finger where the blood's coming out. You don't need a very, very big amount, and then it'll read whatever your glucose is. Glucose is just a simple sugar that your body needs for basically everything: brain function, energy, also known as ATP. Your glucose levels are stored in the muscles and liver as glucagon. Your body will release them as needed in a normal, healthy adult without diabetes. Glucose levels also influence the release of insulin and glucagon in the body. So it's really important that those are regulated. So we have pretty much two types of emergencies you're going to come in contact in the field. You're going to have hypoglycemic patients where their blood sugar is too low. Some causes of this are increased exercise, strenuous exercise, missing a meal, or too much insulin. These patients can be cool, clammy, pale, combative, or unresponsive, even experience seizures. It's important to remember that if you do have a hypoglycemic patient and they are combative, they don't know what they're doing, they won't remember what they're doing. So you just kind of got to keep your cool while maybe you're getting your butt whooped by a little old lady. Some causes of hyperglycemia can be excessive eating, not taking their insulin regularly. These patients are going to be hot, they're going to be dry. A lot of times they'll have frequent thirst and more than normal frequent urination. And if hyperglycemia is left untreated too long, it can lead to DKA, diabetic ketoacidosis. And the most common sign of that is a fruity kind of smell on the breath. And there's really nothing we can do to treat that in the field to this require transport at that point. Let's see. So we kind of went over the causes already. Excessive insulin, missed meals, too much physical activity, confusion, some symptoms, confusion, sweating, trembling, loss of consciousness, hyperglycemia, overeating, underlying illness, not enough insulin, or they've mismanaged their insulin. Let's see. It's important to familiarize yourself with the signs and symptoms of each so you can treat appropriately. When you are assessing the patient, you're going to want to check vital signs, heart rate, respiratory rate, blood pressure, of course, get a glucose level. And it's important to get a patient history. You want to ask, why has this, in a hypoglycemic patient, why has this sugar dropped? Not just, oh, I see a number and I'm going to treat it. A lot of patients, their sugar, they have missed a meal or something and their sugar dropped, and once we get their sugar back up, they kind of want to stay at home and don't want to go to the hospital. But if their sugar's dropped because they've taken too much insulin, then insulin is going to affect them way longer. So we want to get them talked into going to the hospital and getting further evaluation and treatment. At an EMT level, for hypoglycemia, you can give oral glucose or some juice that's in the house if the patient is alert and able to swallow. If they are not alert or unable to swallow, you don't want to put anything in the mouth, and you may need to call for ALS intervention. For hyperglycemia, you just want to check the glucose levels and just monitor vital signs until you get to the hospital. Like I said, there's not really anything we can do in the field for hyperglycemia. And it is important to teach your patients. They may need more education on how important it is to monitor blood sugar levels, how important it is to eat a regular meal, take their insulin correctly. Let's see. All right, our first case study. The scenario 1, patient presented with disorientation, excessive sweating, indicating a medical emergency. EMTs assessed glucose levels and found the patient to be hypoglycemic. Glucose was administered and improved the condition of the patient, and the patient was closely monitored. So again, if they're alert, you take their glucose, it's low, and you give some oral glucose and give it and get that sugar back up. Scenario 2, the patient reported increased thirst and frequent urination, indicating potential health issues. These symptoms are critical in diagnosing the underlying condition. EMTs diagnosed the patient with hyperglycemia after a thorough assessment, arranged for transport to further care. So again, transport is vital in those scenarios. These are some prevention strategies for EMT. Training EMTs on diabetes management enhances their response in emergencies. Knowledge empowers EMTs to provide better care. Engaging patients effectively improves their understanding of medication compliance. So again, just, tell them, hey, you should be checking your glucose 2 or 3 times a day, making sure you stay on top of it, making sure you're taking your insulin, you're eating regularly, things like that. It's another patient education. If they can stay on top of monitoring their glucose, a lot of times it can prevent a medical emergency. Or if they have family, you can help educate that could prevent a medical emergency. And special populations. So elderly patients may have less specific symptoms when it comes to hypoglycemia, hyperglycemia. They may present with frequent falls, frequent infections, cognitive decline, and fatigue and lethargy. And also patients with cognitive impairment, it's very common for them to not remember to take their insulin, not remember to eat, or not remember that they took it and take too much insulin, and that would require transport. So I hope this has helped y'all understand a little bit more about diabetes and diabetic emergencies and how to manage those in the field, and ongoing training, ongoing education. EMS protocols and education changes frequently, so just make sure you're staying up to date with all that. Thank you.